Hi friends, I have the honor to introduce to you Dr. Rajat. He is AIIMS May 2018, rank 10.
Thank you.
Heartiest congratulations, and to add to it, he is a rank 42 in PGI exam. Great performances in the mid-year.
Thank you, sir.
How are you feeling today?
So I'm feeling like on the top of the world, and it's a really great feeling. And earlier, after 4 or 5 days, I'm able to believe that I got it.
Are you now able to believe?
Yeah, I'm.
Are you feeling happy?
Yeah, I'm very much happy.
So in the beginning itself, I'd like to congratulate your parents as well for this exemplary performance that you have done today. I think it's a matter of proud for them as well.
Yes, sir. They have believed on me, and they've given me a chance to take a drop and do your with your full confidence and full time to prepare for AIIMS and PGI for mid session. And I'm very much thankful to them and to my sister. She helped me a lot with her notes, guidance, making me confident, and for everything. In last stage, I used to tell her, you just read these things and tell me, and she was like, okay. In the evenings, in half an hour or 1 hour, she used to tell me all those things, and I'm quite helpful for them and for my friends who were along with me in Delhi and who used to study with me, discuss things with us. I'm very much thankful to them, and also to my UG college, AIIMS Jodhpur. They have made me capable of achieving this, and I'm very much thankful to the DAMS for providing me an excellent TND course, through which I was able to do for in a time combined manner. For in a week I have to complete one subject, and whatever I left I used to listen in TND, and then I used to go at room and read about it, and almost all the things were covered. And whenever you need to revise any subject in short, then you can go through TND paper, and it's like you have completed the whole subject from that. So I'm very much thankful to you, sir, for creating such a nice course.
That's so kind of you. And Rajat, you started with our tablet-based course AIIMS,
yes,
and gradually you decided that it would be even probably better to come face to face, and you
yes,
came
sir.
to Delhi for a test and discussion.
Yes, sir.
So tell me more that how did you approach yourself in the test and discussion? Like, what was your plan before the test? Then how did you approach the test, and after the test did you after the discussion, attending this, did you check your mistakes, or what was your priority?
Sir, I planned for this May AIIMS in the November only. So in November I did whichever subjects I was weak, so I read all those subjects, and in January I joined TND. So I was confident in covering all the subjects in 1 week, but it's very, very difficult to cover those things. So I used to cover most important things, and then I used to go through previous AIIMS 6 papers. So I used to get an idea, what kind of questions they are asking, what are the new questions they can ask, and then I used to read from that, and then in the test I used to do, and then in the test I realized that many mistakes we are doing, and many things we are reading that we should not read, and many things we are not reading that we should read. So I got a lot of things from there, and it boosted my confidence. Sometimes you also feel low whenever you get low rank, but I just believe that I can do it. I knew things. Some are the things that I have not read, that's why I have not done these things. Some are things that I have read but I have not understood them. So many things I was able to clear concept in the TND also. And at final time
TND helped you to it gave you a target, and then it gave you an assessment of the topics that you are missing out on, and
yes,
plus some topics which you know but you don't understand, and you do it wrong in the exam.
Yes.
Probably that way it helped.
It helped
and
me a lot.
After the test?
And after the test, I rarely studied most of the time, because after 3 days you get to next TND, or after 2 days.
Yeah, because mid-year the time is less.
Time is less.
Yes,
so
yes.
most of the time I used to start next subject, and whenever at night or sometimes whatever topics are left, or either I need to revise some things, then I did. For revision thing, whenever the TND was structured in a way that initially it had non-clinical subjects, paraclinical subjects, and then it clinically came. So whenever in medicine it came, so I used to do that same thing of pathology and some kind of pharmacology along with that. So it used to you are reading around 30 to 40% less matter, because all things are repeated on all those subjects. So it was very helpful that the way TND was designed, and low yielding subjects in the AIIMS was kept till the last. So I took chance to miss some of the classes,
yeah,
and revise the things that I've read in the rest of the things.
And that is the reason why we had kept some short subjects towards the end, because we had an idea that what is important, what is not. So we tailor it accordingly, because the idea has to be that we have to finish high yield first.
Yes, sir.
So that is the idea. And did you give grand tests as well, the full course papers?
I just had like 6 months, for like 4 or 5 months. So I gave around 2 grand tests and 1 Zipmer mock and 1 AIIMS mock.
Yeah. Did you enjoy giving the full course paper?
Yeah, I liked it, and I used to see like subjects whichever I was weak in, and it's more important to know which topics you are weak in, because in one test you will do for one subject you are very weak, and in other test you get those things right. But at last you get to know that these are the topics. Some of the topics you come to know that I have not read them and they are important. They must have been asked. That's why they are being asked. So it was like nice, and for some subject I also viewed like video discussions of them, and they were really nice, and
they help you to fill the gaps in between, that understanding gaps are there.
Videos were quite short, so you can cover those things, and I like them very much.
And did you utilize the Facebook group that we have for discussion and doubt solving?
Yeah, I was not like quite active on it, but I used to just follow some posts, and most of the time some doubts that most of the students ask, but it's okay, I don't care much about those most common things. And I don't like controversial questions, and you should not waste your head on them.
Yeah, I think most people, they waste energy on controversial questions, while controversial questions are sometimes areas where nobody has an answer. So you have to kind of trust what the teacher is saying and finish it off, and put your energy on understanding other things rather than trying to solve controversies in medicine at UG level.
I also think like that sometimes you get like it's like right thing, but it's not necessary that examiner will get that answer.
Yes. So there's no point in putting so much energy on it, which is correct thing to do, because when you have less time and you want to score big, this is the way to go. And you were telling me, but I want to know from you right now, so that we can build this discussion further, that what was your rank in the NEET in the November exam?
It was quite bad. I didn't score even 50%, and it was around 10-11,000.
And now from that you could improve to 10 rank in AIIMS.
Yes, sir.
It's awesome
Thank
performance.
You,
because reason I asked you this question in front of the video here is, the audience here is, because I want them to get inspired.
Yes,
because sometimes the person who's scoring 11,000, he thinks that I have no capability to get into a central institute. You understand? Yes, and he doesn't prepare for the mid-year exam. You could have taken that call that okay, I'm not able to do, I'll not do it.
I took a call that I will give my 100% for May, and if I get a mediocre rank, then I will give a chance for November, and that would be my final chance. And I prepared 2 times, but fortunately I went through it in one chance only. Did you attend the AIIMS specific discussion that you've done in the end? It was very great, and for especially for Ops Gynae, it was 2-hour discussion, and we got around 2-3 questions from that, and it was a revision. Last one day I read just about the AIIMS discussion. For that, most of the questions, most of the topics which were discussed, they were asked in the exam. It was very nice discussion. Yeah. From everyone.
Any other particular teachers that you remember today?
No, I would say most of the teachers were great, and for specifically I like surgery discussions were very nice. Microbiology was very nice. Pathology was very nice. In these subjects I was weak, and I get so much things new and able to do solve most of the questions from them.
And these are very important for AIIMS.
They are very important for AIIMS.
Yes. And now I also want to know from you, like you have done very well in an exam like AIIMS.
Yes.
And so I want to know, by giving this paper, what do you think are the core area or style of questions that they focus at, and how did you manage those kind of questions?
So in whatever I think in AIIMS, they will ask you whatever you see mostly in the clinics, or they are typical cases. They won't ask you rare or most common things, and they will ask they will start with microbiology. They will give a question in the microbiology, and then they will ask drug for that, or they will give a clinical scenario and they will ask something about non-clinical. So they ask in an integrated way. They are going less towards the minor subject, core minor subject. They will integrate with them with major subject. So I'd recommend you integrate the things. Whenever you read separate subject, then you should integrate. And for revision also, for once revision you should do in a subject wise, in integrated wise and unit wise. For cardiology you are doing, so you should do anatomy, then medicine, then pathology. So you would reduce your subject by your volume would reduce to around 60% of all of the things. So you will save time, you will integrate things, and you will prepare in the way they will ask in the exam. And most of the time, many questions you would predict and they will like appear in front of you, so it would be a great thing.
So the idea in AIIMS exam is usually that the question is clinical sometimes, but the answer is in basic sciences, or vice versa.
Vice versa.
Vice versa. It's a question of microbiology, but the answer is in treatment. Or it's a radiology visual, but the question is clinical. And they ask management. So that is what is called as integrated. And I think very beautifully he has summed up that in his revision, what he did was, but you know, not all students do it. It's a tough thing to do. That in his revision, what he was doing was when he was reading cardiology on the same time, he started this cardiac physiology, cardiac anatomy as well, so that he could join them together, and then he did not need to do them again for basic
them. And for many subjects, like I have not done physiology individually, but I just read all the graphs and etc. and I got all the questions in physiology.
Yes. And they go towards graphs in physiology.
Graphs in physiology. And
any topics that you would like to, you know, like suppose if you were to give November AIIMS, okay, so what topics come to your mind that okay, these are the topics that they are focusing on?
Most of the things, like they are asking again and again, like aortic dissection, most of the thing, and they are going little on the clinical aspects of the infection, like you should approach the infection in a like syndromic way, pneumonia, STDs, and those tables in Harrison I think are very important. You know, you get every year either in AIIMS or PGI you get a question from them, and they are asking like slightly new things that are happening in everything. So
new FDA approved drug or
new FDA approved drug, or they're not asking too much like in depth, but they are just like which one is used or what is the mechanism of action. And in every subject you should like make core like basic general thing most strong, because like in microbiology they will mostly ask general microbiology, and like bacteriology is most lengthy but least high yielding in microbiology. In pharmacology also most of the questions were from general pharmacology or ANS, and rest of the questions were quite simple, you know, like mechanism of action. So in these things you will cover like 80 to 90% of the pharmacology, and you have to do around like 140-150 questions correct to get a good rank.
And that leads me to my next question. How many did you attempt in AIIMS exam?
I attempt 190.
190. Okay. So were you able to do 190 in first go, or did you do something and then?
No, I usually follow that. I start the paper with a slow pace, concentrated pace, so that I don't miss out, like do silly mistakes in the early, and I never mark for review. So I will use like sheet and I will write on it like I have to review this question. And for earlier in beginning of the question paper I was like quite bit slow, so I didn't like, I marked whatever I know that it would be answer, and I wrote on a paper, and whatever the question that you know I think I should go it again, then I used to mark a round around it, and then I used to go. So
but you must have planned all this before going to the exam.
Yeah, I planned
so that you can apply it, otherwise you get confused.
So in my first round also I attempted around like 170. In second go I do like
20 more questions. Yes. That's the right way to go, I think.
Otherwise you are wasting more of time. You are reading that question again and again.
And and I think the attempt ratio of 190 is also good, I think, because I've seen this year also that most people who have gotten a top 50 rank have done more than 185 questions. Most people, and some people have done even more than 190 as well. Like, because you can't, you know, go less than that and hope to get a top 50, because the number of seats is very less to play for. So either you play to win.
You have to take a like slight risk.
Slight risk. Yes, correct.
So it's all about educated guesses, you know. Most of the like 80-90 questions you are confident about, then rest of them you have to think, and you have to take guesses for that. So
you know, so he has in a nutshell given you an overview of the idea behind AIIMS. AIIMS is like more about integration in the exam. So you have to learn to do the thinking process right. You may call it guessing, or you may call it educated guess, or you may call it thinking process. So you have to think on the day of the exam clearly. If you don't think on the exam clearly, you will find your ranks will fall majorly. You have to learn to think is what his message is.
I did same in PGI also. I didn't go for second round, you know. I like marked 5-10 question. I did a circle, or there are like questions are like options, so I marked options that I have to review them, and I went through them. I marked around 450 I did,
which is usually the ideal number, 450 to 500, 550. This is the where the number is. And plus in PGI again the time management is critical. So you can't think that I will see everything later on.
In AIIMS also it's critical. It looks like there like 200 question in 3 hours, but you know, for every question you have to think about that. So time is
particularly this time I have felt that this time in AIIMS the time was a factor, which was usually, you know, in AIIMS where you have 200 question, NEET you have 300 question. People are usually able to manage AIIMS in 200, but this time I think I've talked to most of the rankers, and everybody has had that some time
because there were less
challenging.
kind of spotters, you know.
Yes.
So everyone has like
Each question
long
was taking
history
time.
and
Each question was taking time.
taking time.
Which I feel is a good change,
Good
good
thing.
change, because that is how the exam should be. It should be forcing you to think on every question. There should be nothing.
It should not test your
Yeah.
memory, you know.
Yes,
It's
yes,
application part of it.
Yes, it should not be just a recall.
Recall.
Yes, I totally agree. So with this, Rajat, I would now put you into a hot seat. I want to know from you that you have been a rank 11,000 last year,
Yes.
and now you are rank 10. We are very proud of your achievement at DAMS. You were a test and discussion student. We are very proud of it. But now I want you to say something to future aspirants, somebody who is at, who is not done well at the May AIIMS and want to do well in November. Can
No, I
you
think-
give some motivation to them?
I think there are 4 or 5 things that are important in PG. First is like your confidence. You should know that you can do it. For every game you play, you should know that you can win it. Then only you are in the game. Otherwise, you are like, you can't win that thing. And second thing is you have to read only the things that you should read, and you should read in a understandable manner. You should be able to think, just like you are dealing with patients and not like you are made for reading the books. You should do like you are being a doctor, and you will do these things, like next thing what to do. Then once you are reading in a conceptual way, it will click to your mind. You have seen the patient in clinics or something like that, then it will click to your minds, and then you will get the things right.
To put it in a nutshell, what he's saying is read to understand, not read to mug up.
Okay.
Read to understand as if you're doing it in a patient, and ultimately it will stay with you. And that is his mantra.
Yes, sir. And third thing is revision. You have to revise things, and once you revise, then you will understand that you are reading many things, that were not necessary because you can't revise them.
Yes. These are all golden words that he has given us, and it is very important to revise, because if you don't revise, you may not retain many things, and you may get confused in the exam. So with these words and with his exemplary performance, I want everybody to take home a very big message that it is possible to improve your ranks majorly, even after a kind of a rank which you might call as a setback. He has a rank 11,000, and most people at his rank and around may believe that we will not be able to do in AIIMS.
Yeah.
But he kept his belief alive,
Yes, sir.
kept working, followed test and discussion in a very clinical manner, kept integrating things in his mind, kept it simple, did not overdo things so that he can revise them, and in the end now he is in front of you with a rank 10. This is an exemplary performance. I'm sure many people will draw inspiration from your interview. I wish him all the best, and I'm sure the country will have a great doctor in him in future. We'll hear more about him in future as well. Heartiest congratulations.
Thank you very much, sir.
Congratulations.